much for speaking with me, especially because it's a subject that we're going to be talking about. It's a series that folks are going to be able to see September 27th. Um, but it's something that is affecting more and more people over the years. It affected your family, it's affected my family. What is the series called and what is it about, please?
Yes, so the series is called Dementia in the Afro-Caribbean Community in Canada, and it really looks at the different aspects of dementia, really the dementia journey from beginning to sort of later stages, which is identifying symptoms and signs, looking at how to manage the disease, thinking about long-term care plans, and then thereafter funeral preparations where necessary. And it's really targeted from our perspective, our lived experience of being Black in Canada, and some nuances within the Afro-Caribbean community. So we've gathered together eight exceptional industry and healthcare professionals and academics to talk about aspects of dementia as well as their own personal journeys and their own insights as well.
Oh, you said personal journey. This is something that you have traveled.
Yes, yes, I have. My father was diagnosed in 2008 and recently passed earlier this year. And so we've gone the gambit of the dementia journey. So we identified the first symptoms when he was acting differently to getting a diagnosis, managing the disease, going through COVID and all the rest of it. So I have a very intimate knowledge of the disease and then supporting other families as well within my role with the Alzheimer's Society of Ontario. So looking at the trajectory of the disease and how it impacts different families, different communities differently. But within the Black community, there are some specific nuanced instances, issues, contexts that we have to be aware of while we're traveling this journey.
Can we talk about some of those aspects, please? And the things, the changes that slowly can happen. Because a lot of times people think that the individual has either got an attitude, oh, they're always angry. Why are they so quiet? They don't really understand because that individual, as they're going through this, doesn't even
Mhm.
understand what is going on with them. And it's almost impossible for them to explain it.
Yeah. So one thing, and this feature is kind of endemic to all communities and the general population. But within the Black community, there is a little bit of an added challenge. One thing is stigma. So dementia is a very stigmatized disease, right? We're talking about mental health. We're talking about seniors' mental health and brain health. And typically, when you think about brain health and mental health, people shy away from that conversation. There's a lot of negative connotations attached to mental health and mental health deterioration, et cetera. And within the Black community as well, writ large, even though we have a lot of diversity within our community writ large, within the Black community, dementia is typically seen as either a normal part of aging. So it's, oh, they're old, that's what happens anyway, just leave them be. And they don't really pathologize it in the way to get medical treatment or attention. Or the other side of it, there's a cultural component and religious component within the Black community that dementia is somehow caused by sinful behavior or some sort of curse or some sort of you've done something wrong and this is your penance for it. And so when we have these two views, which are kind of opposite but similar, it can really dissuade people from seeking help. It can dissuade people from getting medical attention, a diagnosis, or even reaching out to family and friends saying, hey, I'm going through this. Can we get some assistance? And what ends up happening is that within our community, as the studies have shown, we tend to get diagnosed later on in the disease, but we would have had it for longer. So when you present when you're like 75 and thinking, maybe I have dementia, the doctors will say, okay, well, you're coming a little bit later, but it looks like you would have had it for many, many years. And so that piece of not being able to feel comfortable to talk about dementia, to go and have conversations with a healthcare provider or family or friends can really, really delay getting help and really make the burden that much worse for people.
I think the frustration also is not just because of what's going on with the individual, it changes family dynamic completely.
100%, 100%. And in the Black community, I think when we think about family dynamics and family structure, and we think about what it means for parents, for example, to get dementia, and sometimes there is estrangement from the parents to the child, right? Sometimes adult children did not necessarily have relationships with their parents, whereby the dementia journey is someone that they can talk about or support them the best way with, and that has to be attended to because as you know, the loved one with dementia, as they go through the journey and the symptoms increase, more help is needed for them and for the child as a caregiver. They need support, they need education, they need to understand what's happening. And if there are rifts, I always say, dementia can exploit the good and bad in any relationship in a family.
Yeah.
Um, Very much so. So if there are cracks in relationships, I always employ people, try to resolve them, work it out, get therapy, get healing, because it's a journey that really necessitates togetherness and a strong unit to get through.
You mentioned something that some families will do. Some families feel like no, they're not, and that is professional care, being put in a facility that can probably help them even more. That's a very hard decision for families to make.
It is. And within our community writ large, we do caregiving at home. Within our community writ large, when we talk about caregiving in the dementia context and the North American context, it's really talked about from an individual perspective. So you have a
Mhm.
spouse and another spouse. You have a parent and a child doing the caregiving. But within our communities writ large, it's a more communal family affair for those who are able to provide that care. And one of that means that we're going to keep our loved ones at home for as long as we can, as much as we can. And that can be very challenging for caregivers, especially those from the sandwich generation who have children, young children at home, then they have an aging parent. And so they're kind of caught between these two worlds of care needs where they can lose themselves even more, feelings of guilt, feelings of shame, feeling of constantly never catching up, and then the impact on your own health, right? Your physical and mental health as well is also there. Putting a loved one in a care facility is it's a very difficult, for some folks, a very traumatic experience, especially given our history with institutionalization and being treated well in these institutions from a cultural perspective. Families don't want to do it. But sometimes there comes to a point for some families where the care that is needed is beyond what can be provided at home, right? So we put my father in a home. It was a very difficult decision. It took us years to come to that decision. But after a medical crisis, we realized that we couldn't provide what he needed at home. There was, unless we had like a 24-hour nurse coming in and whatnot, it wasn't going to be plausible. And putting him in a home, you would think, okay, well, now he's in a nursing home, so we can step back from the care. No, we were there every day, multiple times a day throughout the day, had a very high touch point with the doctors and the nurses and the PSWs there. Like we had their personal numbers. We would contact them. How's dad doing? We're going to come in now. So we had to work very closely with the healthcare system and the social care system and the long-term care system to ensure his safety. So I tell people, if you have to put your loved one in a home, really get to know the home, the nurses there, the doctors there, and establish that relationship so you become a partner in their care and not just a care partner. And that makes a difference in the quality of care, health outcomes from the person with dementia and the family.
Having dementia, that shortens your life.
It does, and it can, depending on when you get it and how you manage with it. My father had dementia for 17 and a half years. Some people get dementia and they have it for 5 years, 10 years, other people 20 years. So it depends on a few things. It depends on your own physiology, your family history, your genetics, and your lifestyle when you get diagnosed, because there are things you can do to slow down the progression of the disease. So when we talk about risk factors for dementia, there are things that you can do that can increase your risk of getting dementia. And if you do get dementia, though, there are things that you can do to slow down its progression. So when my father got diagnosed, we got diagnosed. As soon as I saw symptoms, I was like, okay, we're going to the doctor. That's it. And we got on the drug at the time, Aricept, which is a drug that helps slow down the progression of the disease. We got him involved with certain activities, certain socialization activities. So we were able to really support him, but that also comes down to his genetics and other things of that nature. And so there's not an absolute it will or will not, but there are ways to manage the disease to improve your health outcomes and your health status with the disease.
So, what will we see exactly in this series?
Yeah, absolutely. So we have clinicians. We have a geriatrician, family doctor, and a nurse practitioner. We have two caregivers and a researcher. We have a founder of a private home, a retirement home, and then we have a social worker, and then we have someone who is a funeral director. So we look at all look at the whole journey of dementia. So what is dementia? Let's define what it is, what it means, how to identify signs and symptoms, What are some risk factors we can talk about and sort of look out for ourselves and our family members and our loved ones. We also talk about stigma around dementia to sort of break that down. So if you do see some signs and symptoms, you can actually go to the doctor and sort of get that treatment. We talk about how to navigate dementia, how to navigate the differences and the changes in dementia that happen, which can be very scary and daunting for family members. Like on Monday, your loved one's acting this way, and then on Thursday, it's a whole other person sometimes. We also talk about if they have to go to a retirement home or nursing home, some tips and things you can do to think about it. And then we talk about estate planning and funeral planning. And then we have a segment on caregivers. We have two of our caregivers talking about their experiences. They kept their loved ones at home. Both of them, it was their mom. They kept them at home and talked about what that was like trying to live in that sandwich generation for one of them, and then also trying to navigate her career, the other caregiver, while caring for their loved one. And then I had the perspective of, putting my father in a nursing home and what that meant for our family and providing care.
Is dementia increasing in the Black community, or is it because we are looking at, right now as we speak, we are looking at the baby boomer generation, which was the
Mhm.
largest?
And so there was a study that came out called the Landmark Study, The Many Faces of Dementia, by the Alzheimer's Society of Canada just 2 years ago in 2023-24. And it looked at a projection of how dementia may be in different communities, different racialized communities, so South Asian, East Asian, Black, etc. And within the Black community, there is an increase of about 300% projected of dementia rates in the community by 2050. Now, these are all a projection, they're statistical data, it's a hypothesis. Because in Canada, we don't yet have race-based data when it comes to dementia across the country. Now, when we look at the research from the States and the UK, that's where most of the research, all the research comes from, talking about dementia in the Black community. It is on the rise. In fact, Black communities and Indigenous communities have dementia at higher rates than any other community. In the UK, it's Black and South Asian have higher rate of dementia than any other group in their society. The reasons for that, is it genetic or is it social environmental? A lot of the discourse and the research has pointed at social environmental factors. So there's something called social determinants of health, and these are non-medical, non-biological impacts or factors that impact your health status. So things like education, housing, employment, income status, etc. So when we look at the Black populations in the Western world, as it were, we tend to have lower health status because of social determinants of health. We don't have the right job, proper housing, we're underemployed, unemployed, we don't have access to proper food sources, and we face a lot of stress from discrimination, anti-Black racism, and how it impacts the body and causes us to age more and age faster. And so when we look at those realities, in Canada, we don't have those figures yet, but what we do have in Canada, we do see that Black populations in Canada also have a lower health status and we have worse health outcomes, again, aligned with social determinants of health. So we don't have the best housing options or availability, our jobs, employment, underemployment, unemployment, economic status is also low. We experience higher forms of discrimination, self-reported, so all of these things in the Canadian studies have pointed to health impact, which is higher depression, anxiety, worse mental health outcomes, worse cardiovascular outcomes, etc. So we do see some correlations happening there. So it wouldn't be impossible to think that the way in which the Black experiences in Canada has an impact on the way we age as Black people in Canada as well.
Other than watching this series, any advice as we wrap this up can you give to any families out there who are now in the process of beginning this journey?
Yeah, and so there's a couple of realities that we need to really, speak to. Getting a diagnosis in Ontario, anyway, for dementia can be a long process. There is a shortage of doctors to provide that diagnosis. There's a shortage, there's a long wait list, so getting a diagnosis can be difficult. We understand that. We also understand the anti-Black racism in our healthcare system, which makes a lot of people not comfortable going to see a doctor, makes a lot of people not wanting to trust the doctor's opinion. All that is very true. What's also true, though, is if your loved one is experiencing signs and symptoms of dementia, start that process anyway. An early diagnosis almost guarantees you'll get on the right medications with the right treatment to be able to navigate the disease better. We also have something called cognitive testing in Ontario. So it's not a formal diagnosis from a doctor, but you can go to a MINT clinic, you can go to one of the Alzheimer's societies in your area and get cognitive testing to get a sense of where you're at cognitively, what your cognition is, what you could be thinking about, and how you can help yourself. As there are risk factors, there are modifiable things you can do to prevent those risks as well. I encourage people to look into that. I encourage people to contact First Link with the Alzheimer's Society of Ontario. It's a program, it's a referral service. People can call in and say, hey, I think I might be experiencing some symptoms, or my loved one. They set up a file, get you connected to the right people, and you can start that process and that journey together. I will ultimately say within the Black community, we tend to suffer in silence because we don't talk about it to other people. And I will say, talk about it. I talk about it to other people. And when I do, and inevitably someone says, oh, my aunt and oh, my grandfather, oh, I know somebody, and their hand goes up. So we're experiencing it. And coming together collectively as a community can really help understand the journey, decrease those feelings of loneliness, isolation, shame, and really build a sense of togetherness and strength to be able to navigate the disease.
Thank you so much for doing this interview, but more importantly, thank you for being part of this very important series. Thank you again.
Thank you so much. Thank you.